Congratulations on receiving your clear aligners. Your help is essential for success during your orthodontic treatment journey. Compliance. Using your aligners properly will help you achieve your desired treatment results. It is essential that you wear your aligners for 20 to 22 hours per day. Wearing your aligners for less than 20 hours a day will compromise your treatment results. Each aligner is worn for 1 week, and you'll progress through your aligners sequentially. Aligner numbers are printed on the package and on the aligners themselves. If for some reason you're not able to wear your aligners for at least 20 hours daily on a particular week, continue wearing that aligner for a few extra days to ensure all the programmed movements express according to the plan. There's no need to keep your old aligners, and it's recommended that you throw them away as soon as you switch to the new set to avoid confusion. If you lose or break your current aligner, go to the next one and wear it for 2 weeks to make sure all the programmed movements express fully. A chewy is a soft chewing device about the size of a cotton roll. They are used to help push the aligners into position over the teeth. It is recommended to use your chewy for at least 10 minutes a day. Make sure your aligners fit properly by checking for gaps between the tooth and the edge aligners. If the aligner is not sitting on each tooth properly, use chewies to push the aligners tighter onto your teeth. Tip: when removing your aligners, start from the back. This will make it easier to remove and reduce the risk of damage. Discomfort. You might experience some discomfort while your teeth are being moved. A common way to relieve soreness is to use a typical over-the-counter pain reliever that you would use for a headache. Also, eating and drinking cold foods will help to relieve the discomfort. Additionally, if there is a specific area that is bothering you, you can apply orthodontic wax to the pressure point. If any part of your aligners are rubbing against your gums and causing discomfort, you can trim them with small scissors. Eating. One of the big benefits to choosing aligners over traditional braces is that you have less diet restrictions. You do not need to worry about breaking brackets with aligners. But it is still recommended to avoid sticky foods because there is a higher chance of food debris being left behind when you put your aligners back in. Always remove your aligners before eating. Juices and sodas can stain your teeth, and sugary drinks can cause cavities. Be sure to remove your aligners before drinking anything other than water. Cleaning and aligner care. Good oral hygiene is very important during your aligner treatment. Make sure that you continue to see your general dentists every 4 to 6 months for regular checkups and cleanings. It is recommended to brush your teeth after eating before you put your aligners back in. This will prevent food from getting trapped on your teeth by your aligners. You should also lightly brush your aligners every day with a soft, dedicated toothbrush to ensure the aligners are clear of food debris. A small amount of toothpaste will help keep your aligners fresh. Clean your aligners with room temperature water. Heat can distort your aligners. Never clean your aligners in a dishwasher or leave your aligners on a dashboard of your car. When you are not wearing your aligners, make sure to keep them in a case to prevent them from being lost or being damaged. Never put your aligners in a napkin or in your pocket. This is how most aligners get lost or broken. Pets are known to chew on aligners, so keeping them in a case will also prevent pets from getting a hold of them. Attachments. Attachments are additional components used with the aligners during treatment. This can consist of holes cut in the plastic aligner, glue, or buttons. Some attachments stay on your teeth even when you remove the aligners. Because of this, you need to be cautious when brushing and eating. While brushing, make sure you gently brush around attachments to prevent damage. While eating, make sure you are cautious when biting into hard foods such as nuts and hard candies. It is best to avoid hard foods whenever possible. To ensure that your treatment stays on track, you should regularly check your attachments to make sure they are not broken. If an attachment needs to be repaired, such as a button breaking off, contact us to see if you need to schedule an appointment to get it repaired or replaced. We hope that this has helped answer all your orthodontic questions. If you are confused about any instructions you received, please ask any of our friendly team members for clarification. Thank you for choosing Orthodontic Experts.